The way Medicare works in Australia is that the right thing to do is to go and see the general practitioner. Now, general practitioners are very experienced and they take care of a lot of arthritis, and they can do most of the initial workup for you. They'll know your history, they'll know what medications you can and can't take safely, and they'll also understand your family situation, etc. So they may well talk to you about modification of your lifestyle, maybe losing a little bit of weight, changing your exercise, giving you simple painkillers, organising appropriate imaging. When the general practitioner feels that you have now gone beyond what they can treat, they will provide a referral to come and see me. Now, can you come and see me directly? Well, technically you can, but under Medicare you won't receive a Medicare rebate during the consultation because you don't have a general practitioner referral. Personally, I prefer it if the person's seeing their general practitioner anyway, because what it means is that they've had all that more basic treatment before they get to me, and then I can talk to them in more depth about what the more advanced treatments are. So the patient would then ring my office. They'll speak to one of my office staff who would then make an appointment for them to come and see me. Generally speaking, the office staff will ask them what body part it is, how long the problem's been there, who their general practitioner is, and whether they've had any imaging done of that body part. Now, we generally don't get people to have imaging done before they get to us because they may not do the right X-rays at the right angles. We prefer to have that done in our offices if the person hasn't had imaging done. If they have had imaging done, of course, they should bring it along to us. Now, we have different pathways of how people can fill in their paperwork. They can do it online, but a lot of our older patients don't really want to do that. They still want to come in and fill in the paperwork. So they come into the office, they fill in the paperwork, and then they will then come into my office and we'll have a lengthy consultation about what the problem is. Part of that process is obviously history taking. I'm going to take a detailed history from the person in all respects, not just about the body part that's causing them problems, but about general medical problem and also what treatment they've had in the past. We'll review the imaging together. If they haven't got adequate imaging, we'll arrange appropriate imaging, and then we'll institute a treatment plan, which is not me telling the patient what they have to do, but a discussion between myself and the patient as to how to move forward to try and resolve their problem.